My name is Lauren Smith, and my research proposal was done on operant conditioning and its effects on children with aphasia. For my study, I researched aphasia, which is a communication disorder that results from damage to the areas of the brain that contain language, which is usually caused by a stroke. Aphasia can be caused by other things, such as a brain injury or a tumor. Symptoms of aphasia include difficulty producing language, difficulty understanding language, and difficulty with reading and writing. Robert Goldfarb conducted a study in 2006 that researched the application of a behavioral framework for the treatment of the disease, which includes the principles of reinforcement and punishment, and also includes melodic annotation therapy and the application of contemporary alternate augmentative communication systems, also referred to as AAC. In my study, I hope to investigate the effects of operant conditioning and programmed instruction techniques on the facilitation of language development in children by using AAC devices to supplement vocal language during therapy. By using these devices, children will be able to improve the language devices needed to produce vocal language, and which will then aid in the development of vocal language on their own. I believe that the children who are given the AAC devices during therapy, which will employ the use of visual reinforcement strategies similar to the strategy used by Goldfarb, will show a greater improvement in the development of vocal language than the children who are not given the devices. The participants of my study will be young children with aphasia who have not received treatment prior to this study, in addition to receiving informed consent from their legal guardian or guardians. There will be approximately 100 children who will participate in this study. The materials needed in my study will be the AAC devices, pictures, and software. The AAC device will be used in therapy, and it is called Dynamo, previously referred to as Dynamite, and it will be used for 45 minutes. The other material I will need is pictures, and the children will identify various pictures using the AAC device. Each picture will contain images from categories such as animals, family members, common household items, and shapes. Each picture will be an image that can be easily identified by anyone over the age of 2 and will be viewed by the child for 30 seconds. The control group will receive an additional set of pictures that will have the word of an item from a photo on them in order to allow the child to identify the object in the image presented. The software I will use is Excel, and that will be able to allow me to construct a graph that will show the positive improvement in the child's ability to produce vocal language. I will assess each child's vocal language ability after each treatment session. I will use that information to then rate each child's improvement on a scale that ranges from 0 to 5. A score of 0 indicates that the child showed no improvement in their development of vocal language, and a score of 5 indicates a very significant improvement. Each score will be constructed by referring to the table below. For my procedure, the participants will be randomly assigned to 2 groups, the treatment group or the control group. The treatment group will receive the AAC devices during treatment. The control group will not receive the AAC devices during treatment. The patients will be shown images and given 30 seconds to identify the item in the picture. If the patient correctly identifies the item, then the patient will be shown an image of a smiley face emoji. If the patient incorrectly identifies the item, then the patient will be shown an image of a frowny face emoji. When the 1-hour session has finished, I will assess the child's improvement by using the table listed in the measurements. After the 10 treatment sessions, I will collect the data and determine whether the treatment group shows a greater improvement in verbal language ability than the control group. My expected results for the study are that the children in the treatment group will show a greater improvement in language abilities, specifically their ability to produce verbal language. The AAC device will facilitate the development of verbal language by improving other language abilities such as reading and understanding language, as opposed to the control group who will show little improvement in the development of verbal language. However, both treatment and the control group will show improvement in understanding language as well as reading. These results would be consistent with the hypothesis that states that the children given the AAC device during therapy will show a greater improvement in their vocal language ability than the children who did not receive the device. The expected results are consistent with the results found in Goldfarb, which discussed how AAC devices facilitate language development in children with aphasia. In addition to these findings, the results show that by using visual reinforcement, children are better able to improve upon the language abilities that were previously impaired. Studies have shown that AAC devices can be an efficient treatment for patients whose speech is ineffective, but it can be a challenging treatment due to the problems with contextual fit. Johnson conducted a study in 2006 that found that the problem of contextual fit, meaning the compatibility between a treatment and the characteristics of the person in which the treatment is being implemented, may result in ineffective treatment because the patient was not able to reach their communication goals. This result can be due to many factors, one of which is the treatment may require too much effort or the interaction does not result in the type of communication the patient wants to achieve. Although the use of AAC devices in treatment may not be effective for every patient, I continue to believe that the hypothesis will be consistent with the results of the study and will further prove the benefit operant conditioning and AAC devices have on the development of vocal language in children with aphasia.